certainly one board in Scotland, if you're a Sparrow patient, when you're admitted, they actually start the discharge planning virtually straight away and involve the case manager and multidisciplinary team. So certainly that's one of the main benefits. But some of the more recent applications as well, things on the polypharmacy side, there's been a lot of interest in the prescribing data. And again, we are shortly going to be providing, again, a subset of Sparrow patients to boards to be used in identifying people who may have polypharmacy issues and who would benefit from a medication review. With Sparrow being a national tool, we are quite coordinated. I suppose it's a more coordinated approach, whereas in England, I think it's now, you've got lots of competing products, and everyone's going in a completely different direction. Whereas in Scotland, there are alternatives to Sparrow, but it's still the main tool that's used. So again, in things like polypharmacy or using the data for quality and productivity indicators, again, you've got a central data and there's a structure there, which actually perhaps makes things a lot easier. Because Sparrow is developed and run centrally by ISD, we're constrained by what data is available nationally and national data sets. So the biggest challenge we face is linkable national data sets. And the big step forward with version 3 of Sparrow was when we could start to link in prescribing data and A&E data. So again, there's now going to be a bit of a pause in terms of how we widen the data set, because we're now waiting for NHS 24 and Scottish Ambulance Service data, which will soon be available as a national data set in Scotland. We now need to wait till A, it's available, and B, the coverage and completeness is at a level we need to actually then start to build it. And I suppose the other challenge as well is there's still a lot to be done, I think, to convince GPs. We're actually starting to find now with the latest version there are far more local enhanced services in parts of Scotland, and quite large numbers of GP practices are registering to use our Sparrow online tool, which is a way of directly accessing Sparrow data for a practice. But again, it's quite common to find yourself in discussions in meetings with GPs who again quite clearly aren't convinced. Having launched the version 3 algorithm in January, to some extent it's almost a period of consolidation now, in that we've got the new algorithm, and what we're doing at the moment and want to do more of is get out and talk to not only current users of the data, but there are lots of other potential users of the data out there, and there's particular information within the Sparrow data sets which we think will be of interest to particular end users. So there's one or two areas where we're quite keen to try and develop the use of Sparrow data. There's one or two other developments going on in the background as well, in that we want to automate our algorithm so it runs automatically in the data warehouse. There's an interactive tool we're developing which will build risk score into a management information system, and again give a dashboard, drill down facilities. So we want to develop that, and then as I say, longer term there's other data sets, and again also a lot of interest in Scotland in early admission models. So again, that's an area which we're quite keen to pursue.